Hello, this is Tom Goddard. I'm the founder and chief executive officer of Integral Healthcare Solutions, a healthcare consulting firm that helps our clients with accreditation and much else. I'm joined today by Sue DeMarino, Integral Healthcare Solutions Chief Compliance Officer. Integral Healthcare Solutions has been around for 21 years ago. Before that, I was URAC's General Counsel and Chief Operating Officer. I started with URAC in 1998, and about 6 months after I joined URAC, I was joined, as was the rest of URAC, by Sue DeMarino, who joins us today. And you joined in mid-99, right?
Correct.
That's right. And so Sue and I have known each other for almost a quarter of a century, and in this, both as friends and in this professional capacity as working on accreditation generally and specific URAC accreditation. By background, I'm a lawyer and a psychologist. Sue, why don't you tell the listeners and viewers your professional background?
Sure. I'm a registered nurse. I am a certified case manager. I was one of the first case managers in the Pittsburgh area that was in the hospital setting. And I left the hospital setting and was recruited by URAC for my case management experience. And I joined them in URAC in 1999 when the case management standards were first released.
My recollection, Sue, is that when you joined URAC, we didn't see you for a while because you did, it seemed to me, about 1 million case management accreditation validation reviews just months on end. Where's Sue? Oh, she's in Ohio doing case management reviews.
Yes.
Is that your recollection as well?
That is my recollection. And I can tell you, shortly after being there, we got the contract with the Ohio regulator for all of their managed care organizations to be case management certified. So I know every bit of Ohio, from Toledo down to Columbus, Cincinnati, Cleveland, and Youngstown. So it was a fun time.
And not only are you an expert on geography, particularly of Ohio, but I think it's a fair statement that you know about as much about case management accreditation as anybody in the United States or the world. You weren't just a reviewer at URAC in your 16 years there, were you?
No, I was the vice president of accreditation. I served as the director of accreditation, the supervisor, and worked my way up until vice president of accreditation. I left there in 99. I'm sorry, in 2015. And joined IHS, as you remember, Tom. He recruited me, and I was really happy to join this wonderful team. And I have been with them almost 8 years now.
Yeah, and we have been delighted to have you here. It's just a treasure to have such an expert on accreditation generally, URAC accreditation specifically, and today, because we're talking about case management standards, to have such an incredibly deep expert on case management. So let's dive right in. We're going to talk today about the first section of the new URAC case management standards, which is version 7.0. And that first section is called Case Management Staff Qualifications, Trainings, and Responsibilities. So Sue, why don't you dive right in and start telling us about these new standards?
Sure. Well, we're going to evaluate those qualifications, training, and responsibilities from the case manager perspective, the supervisory requirements, as well as the non-clinical personnel who support the case management program. We'll start with the case manager. So their qualifications, they must have a license with a scope of practice that permits independent assessment. That's really important. So basically, it's a registered nurse. URAC does not, as you may know, Tom, LPNs may not do an independent assessment. So an LPN would not be a qualified person to be a case manager. There's also another caveat for that behavioral health section. So they might be a social worker or someone who has a bachelor's in a health and human services area. They must also, however, have a supervised field visit in either case management, behavioral health, or vocational services, or 2 years of full-time equivalent providing direct patient care. So again, nurse case manager has to be an RN with a scope of practice that permits that independent assessment, or be a social worker, health and human services professional that has had a supervised field visit in case management, behavioral health, or voc, or 2 years of full-time equivalent experience providing direct patient care. The next section we'll talk about are the competencies. So we have to ensure that the tasks these individuals are completing align with their scope of licensure. So what do I mean by that? So for instance, if you have a behavioral health issue, a social worker could do that intervention. However, if the only issue was related to, for instance, congestive heart failure, well, the social worker doesn't have the scope of licensure to be able to manage that patient. It would have to be the nurse. So that's what that process is looking at. There has to be a collaborative approach. It has to be member-centric, and they have to be able to demonstrate that their interventions are working toward an improvement in health outcomes.
So I've got a question for you. Tell me a little bit more about what does it mean that it has to be a collaborative approach, and how might our clients demonstrate that to URAC?
So it would be the training that they provide to their case managers that show that they've been given training on how what motivational interviewing skills, or some of the new mechanisms that are in the literature now on how to be able to engage a member, like engagement techniques. And always it has to be member-centric. So if you look at the definition that URAC recognizes for case management, it always talks about the member, the patient, or the injured worker.
And how might it not be? To a layperson, member-centric almost seems assumed, but apparently it's not. Again, so there's an affirmative obligation on our clients to show that their program is, and the competencies. Actually, this is the competencies are member-centric. How does one demonstrate that for a case manager?
So again, they would do that through their engagement rate. They would be able to demonstrate that with interaction, ask the documentation related to the assessment, making sure that they are collaborating with the patient, the providers, other healthcare team members, and in workers' comp, it would be with the injured worker, the employer. And as always, as I indicated, the patient has to be engaged in the process. If for some reason they cannot be engaged, then there has to be documentation on why. And then you might be collaborating with the member or their family.
Got it.
Or caregiver.
Some representative of the worker who can't participate themselves. As I understand it. Got it. So let's move on to trainings.
Okay, so the training is split out in two areas. There's an area where URAC defines what must be in the orientation to the job, as well as an area that talks about the organization enabling educational opportunities for case managers. Regardless, you have to demonstrate through documentation that you have provided these, whether it's part of the orientation or providing those educational opportunities. The first are related to legal requirements of acceptable professional practice. Evidence-based guidelines. You have to train the case manager on what evidence-based guidelines are. The standards of practice that they need to fall under. There are both licensure scope of practices and there are case management scopes of practices. So you want to make sure that they understand both. Social determinants of health. As you all have seen lately in the literature, this is a key characteristic that must be evaluated in order to improve outcomes. If a patient or an injured worker doesn't have enough food to eat or has no place to live, they're not going to want to collaborate on a plan of care, things like that. It prevents them from getting the services that they need. And then, of course, health equity. They should be trained on health equity. You know, we see all the time now, equity, inclusion, and they go hand in hand.
Mm-hmm.
And then, of course, they have to be trained on the case management policies. And those policies need to include the process by which they're going to be evaluated on their competencies.
And then you also spoke about requirements for the case manager's orientation. Can you flesh that out a little bit?
Sure. First of all, they have to be oriented on the credentialing requirements that they need in order to hold the position that they've been hired for. So that they do, like, for instance, if an organization requires a case manager to have a certification, they need to know that in order to maintain those CEUs to get their certification to begin with. They have to be trained on the rights and responsibilities of the member injured worker complaint process, cultural and linguistic competencies for the population served, diversity, equity, and inclusion, and again, social determinants of health and those related interventions that you may need to put in place in order to mitigate those any needs that were identified during that social determinants of health evaluation. They also need to be oriented on how to do an assessment, how to do the care plan, how to develop the care plan. And then to your earlier question on collaboration, there are activation, motivation, and engagement techniques. And we want to make sure that the staff have that training in order to help them engage those patients and injured workers.
Got it. Thank you. Now I think we're shifting gears now to the qualifications and responsibilities of the case manager's supervisors, are we not?
Yes, we are. So the supervisors must meet those minimum qualifications that I discussed earlier as a case manager. In addition to that, once they have done direct supervision of the case management process in the organization in which they're hired for 3 years, they must have a case management certification. URAC used to identify what were acceptable case management certifications. They no longer do that. They allow you as an organization to define those acceptable case management certifications. And if your staff, social workers, counselors, and nurses can be supervised by a counselor, as long as the nurses have access to a doctor or an advanced practice clinician to do that collaboration with them or be a resource to them.
Got it. So a supervisor is a case manager who has extra qualifications that are spelled out by URAC. Thank you for spelling that out. And so let's talk about the responsibilities of the supervisor.
So, of course, some of them are very obvious. Managing staff. They need to communicate any updates related to the case management process to the case management staff. They have to help facilitate training, facilitate resources for the staff in order to do their job. Resources might be a referral list of who they can refer to. It might be policies, procedures. It's the tools, the assessment tools. It's the plan of care tools. So that's part of their day-to-day responsibility.
Got it. That makes sense. Now, of course, a case management organization doesn't just have case managers and their supervisors. Let's talk about the others.
Sure. Well, there's support staff. And there's two standards that deal with case management support staff. So the first talks about their roles and responsibility, and the key role is that they may not that they may not do or evaluate. They may not do any type of an assessment. They may not interpret any clinical data, and they have to have access to case managers as a resource in their day-to-day functions. That does not mean they have to be sitting next to them. And a lot of case management companies, the case managers and the support staff are remote, but then the policy and procedure would then have to indicate within what time frame the case manager would have to get back to a support person should they have a question. It would also have to define how they would access those case managers if it's a remote setting. For organizations that are still bricks and mortar organizations, oftentimes they will have the case management support staff in a pod with other case managers. And that's a mechanism you can demonstrate compliance as well.
Got it. Got it. And now orientation and training of these support staff members?
So the orientation has to include the scope of their activities. What are they allowed to do? So for instance, can they make referrals? So the case manager would say to them, I need a home care referral. And so then they would call the agency and arrange that. But they could never gather the clinical data, assess it, and make recommendations based on that.
So it sounds like it's an important part of the orientation to not just tell them, here's what you do, but to make absolutely clear, and this goes back to the previous discussion about the prohibitions against stepping into the roles of that are uniquely those of the case managers, to tell the support staff, you absolutely cannot do X, Y, and Z. That sounds correct?
That is correct.
Mm-hmm.
And they also have to define the clinical escalation process. So they have to have protocols in place to say, if you hear this is who you need to escalate it. So for instance, if they're talking with an injured worker and a patient and they're threatening to harm themselves, they need to understand what that escalation process is.
Might that also apply if all of a sudden they're doing their staff support jobs, being very careful to stay within their lane, their non-clinical lane, and all of a sudden there's some sort of event that calls them into or tries to pull them into a clinical choice, and how to engage a case manager at that point? Might that happen?
Yes, indeed. And that's often what happens.
I can imagine. All right. Well, how often must training happen?
Well, besides the initial orientation, there's an annual training update. And during that training update, they need to be able to hear information on their role, what their responsibilities are, and any compliance program requirements. So things like HIPAA, ITEC, things like that.
So this isn't just if their role changes or if there's new program requirements. Even if everything is just the same, they still need to go through this training on responsibilities and compliance program requirements every year.
Yes, think of it as a refresher course.
Got it. Got it. Well, Sue, thanks for this portion of our case management version 7.0 series. In our next video, we'll talk about the requirement for the program itself. Thanks so much, Sue.